knew nothing about the business of medicine or where to start. Well, to have a managing company, because right now, like, we don't have anything to manage.
So where did that go to next?
So it left me very confused because I'd had this plan of like emergency since internship, end of internship. So I didn't actually know what I wanted to do. And I knew a lot of what I didn't want to do because I would want to have more regulated hours. And unfortunately, I think while we're specializing, being a GP is seen as almost like, oh, you can make it to anything else, so you're just a GP. But actually from the ships and from my time at emergency, I started realizing that like primary care was really important. Not that it ever wasn't, but how important it was to do it well. Because at emergency, you're just stemming the flow of whatever crisis you're dealing with, but you haven't actually made sure that that person lives better. You just stop them from dying. So I said, let me go try some GP work. I didn't want to go into the clinic system because, again, there was no flexibility. It was like, you do all these hours or you do nothing. And you don't have a lot of say of how that clinic is run, and that can be very disheartening. So I decided to try GP work, and again, got really lucky. I emailed 2 or 3 practices where I thought they resonated with the type of medicine I wanted to do. One was in town, and they offered me a 1-month locum immediately.
Okay, nice.
Got into it, actually really enjoyed it.
And what part of the kind of GP practice did you enjoy? Because you were saying you enjoyed the adrenaline rush of emergency medicine. I can imagine this is a bit different.
Completely the opposite.
So what about it did you enjoy?
So just being able to connect with people. And really addressing their concern, which is what we're taught in family medicine, but this was in a more natural way. Kind of getting to do the follow-up, and not everything was an emergency anymore, so it didn't cause you any stress or anything like that. So I found quite quickly that like just sometimes allaying people's fears of really minor things that we're not even worried about as doctors, but that's what's brought them to us, was really important. And it was a rewarding experience.
And you didn't miss the adrenaline rush or anything of that? Okay.
No, I loved knowing that like I was going home at 5 o'clock and that my weekend was off and I could see my family. So
okay, so and then also was it quite a supportive practice? Like
really supportive practice. So they had 3 co-owners and a few like associates, I think 2 or 3, who were younger, my age, and almost every day the oldest owner would come and check in, what happened today, what interesting things did you see. So it was a kind of a really great practice of like, you could pop into the next room and say, can look at this please, I don't really know what I'm doing, or this is really interesting, can take a look. So it was a really great thing, because I think I thought that GP or like a general practice would be very isolating, and that was completely the opposite.
Okay, nice. Okay, so still nice supportive people. Okay. And then so you tried out that, you realized you like it, and then that's obviously quite a big jump to saying, okay, I'm going to start my own. Because obviously less supportive, more stressful. So the things that you were kind of going away from. So what pushed you to try and start your own?
So I actually moved from that practice to a practice in Rondebosch, which had a health center basically. So it had counselors, had a dentist, had a really nice owner as well. I did find that they weren't necessarily as like interested in it, like weird and wonderful cases, so I missed that part, but again super supportive, and I realized like that was sort of what I wanted for myself, to build something where I could fuse the two, you know, have people that are very collaborative but also have this support center where it doesn't feel too clinical, but you can get the right support for your patients or the right team together. Also, unfortunately, income, when you are locuming for somebody or working under their practice, you do lose a lot to either overheads, or often it's just sort of like anywhere between, I'd say 40 to 60% that you keep and they take the rest. And you understand that they've put in the time to build the practice, but do you want to do that for 20 more years? Do you want to work for somebody else, or do you want to build your own thing, do medicine your way, and also make a better salary. Okay. So that was a deciding factor.
Okay. So now into the nitty-gritties of starting your own GP practice. So obviously there's a lot going on. So from taking the decision to starting your own practice, what were the first steps?
So the first thing we did was we actually went to this South African Business Health Conference that happened for the first time last year, just because we felt like we knew nothing about the business of medicine, or where to start. And in some ways that scared us quite a lot, because it suddenly was this whole wealth of information, and we felt almost like too scared to start, because there's so many ducks you have to get in a row that you don't even think about. Like initially we just thought, okay, all we have to do is like find a place and then start. And then you realize you've got to register a business, you have to have people help you with your tax and your accounting. What are you going to do about your reception? Like, so there were just more questions than answers initially. And also that conference was more geared towards, I would almost say, like big business side of medicine, like, you know, setting up a massive clinic. And we just felt like that wasn't what we wanted. We want something personalized and where people feel connected to you as a GP. So we didn't quite find out, like we found a lot of knowledge, but not exactly how we needed to do it. So then we started trying to find the right location first,
and then how did you find that information? The like kind of, because you're saying it's for big clinics or big hospitals to start. How did you find the information that you needed on how to start, like the practice you wanted to?
So we took a lot of the advice, but sort of just scaled back massively, because we weren't trying to get millions funded by a bank to start something. I think also a little bit like nervous to be extending ourselves too much debt-wise when you don't know if something's going to work at first. Like, I think big businessmen and good big businessmen take big risks, and like I'm not brave enough.
And they've got the safety net of some capital to kind of fall back on. Okay, and then how do you register the business?
So we registered with the PCNS system to get a group practice, because that's how we decided we'd like to start. Just to do everything under that umbrella. We also registered an Inc. As our business to run it.
What's Inc?
So you can either practice as a private, a sole proprietor, or a partnership, or an incorporation. So there's different pros and cons to all of them. If you're a sole proprietor, it's a lot less admin. You're just basically practicing as yourself, and you get paid as a person, as opposed to having extra things. There's different variations on taxation and how you can join in terms of partnerships and things like that. So in terms of future growth, we decided on an Inc.
And then
we registered that with the CIPC.
So in terms of taxation, everything comes up from the business, not you yourself become liable.
So you still get, like, we get a salary, and then we'd be taxed on that still.
On your personal salary.
So, yeah, but for example, the business, one day when we're making a profit, that tax level is lower than an individual tax level. So,
and that kind of information you got from this conference?
From the conference, and then also from talking to accountants as to how to set it up. So that was one of those things that was a little overwhelming for us, because in the conference they talked about all these structures, these business structures. So they talked about having like your Inc. as we have, and then having a holding company, and then having trusts, and having this and that. And we're like, we have no assets right now. What do we have to have? And like, where does it become valuable to have a managing company? Because right now, like, we don't have anything to manage. How much of this admin is absolutely necessary? Because some of the things they said was easier to set up from the start, and then our accountants, who we really do feel like we trust, just kind of spelled everything out. We did meet with 2 other groups of accountants as well, so before we decided on one, because what we did find was, like, you have to find somebody that you're comfortable to work with and you feel you can trust. So the other 2, we didn't feel like they answered our questions well. The one got quite almost nervous and agitated the more questions we had.
Okay.
Because I think he's not used to doctors wanting to know about their businesses.
Yeah.
Like, we go in, we see our patients, and we hope that the money gets paid.
Yeah.
So that just didn't leave us feeling quite settled. Okay. Where these guys have been really straightforward and have provided a lot of knowledge.
Nice. Okay, so you've got the knowledge, kind of the basics of how to start.
Mm-hmm.
And then was the next step kind of finding a place to practice?
Yeah, so it was one deciding, do you rent a space, do you buy a space, and then where that needed to be.
Mm-hmm.
So we looked at a few options. We looked at being in central Cape Town, we looked at Century City, and then I had the idea that this area would be better. Because the other two are quite full, there are a lot of established practices.
Mm-hmm.
Main Street is a little bit newer, but still 20 years old. So
bit of a saturated market.
Exactly. And they're not building any further there. They've reached their max point of development, where I knew that this area was booming like crazy. And we also felt like the people that were moving to the area were really diverse. And a little bit of a more representative of South Africa as a whole compared to, say, Rondebosch. And also the age group. So just having young families, young working individuals, it just felt like it would be an easier fit, and they'd age with us into the practice.
Okay, so you found the area, and then kind of what setup did you have to do from there?
Yeah, so we looked at a few options. We looked at a house to try renovate that and make that a usable area. Our biggest concern was having commercial rights or business rights to a property, which was not guaranteed, and we hadn't seen anybody be officially approved in the area yet.
Okay.
So that was too much of a gamble to say put down a few million or get a bond for that amount to hopefully be able to open this practice in the area. And so we started looking at commercial properties, of which there weren't very many. And that's how we ended up finding this place, which is in a business park.
Okay.
There was another doctor here, which was a little concerning. But then we realized that the area was expanding so rapidly that there was always going to be enough patients, and people need different fits.
Yeah.
So we said, you know what, we'll just start here. Our long-term goal is still to build something on a ground that has business rights and like have a health center. But that's a slight pipeline dream.
Okay. Long-term goals.
Yeah.
Okay.
Or medium term.
And okay, so you found the space. What is your kind of target market? Are you looking more at the younger families, or is it just kind of basically general whatever comes in?
Yeah. So we've found already, and what we were expecting was sort of the 20 to 40 demographic in terms of age groups. Most of them do tend to be young working professionals, sort of entering into mid to high income markets, but there is a bit of a range here. So there are some low income patients that we have as well. And you see that represented also in medical aid choices, for example. And yeah, so we wanted to be a very family-based practice where absolutely anybody feels comfortable. So you can bring your kid when they have their snotty nose, you can come for your women's health, you can come for your mental health. So we didn't want people to feel any barrier to access to care.
Okay. And then, so you mentioned medical aids. How does that work in terms of kind of registering with the medical aids, billing medical aids? How do you know kind of in terms of the patients coming that they have medical aid, that their medical aid covers you? There's obviously a lot to do with medical aids. How did you learn about them, and how do you register with them?
So it was a lot of decision making in that period, because some practices decide to go as cash only and you claim back from your medical aid. But what we realized was for the lower income medical or lower plans in the medical aids, they're getting more restrictive. So if you're not registered with them, they don't get reimbursed, and it's not fair on the patient. So they're either not going to come see you, or they're going to lose money when they come see you, which wasn't nice in thought. So we actually decided to go with Investec for our banking, and they have a company that links to them who will register you for free. with medical aids, which is really nice, and something for new practices to know about. So they just, they know all the common medical aids. They don't know absolutely every one of them. There are like one or two that we've come past subsequently that we've done ourselves. But all your big wigs, they'll register you with. And some of the new smaller ones. So that took a huge chunk of admin off my plate. The next step was to decide, because again, with these sort of restrictions or them wanting you to, they ideally want patients to start seeing one GP or one practice so that you have continuity of care. So a lot of them will only pay if you are contracted to them. So that's separate. So registration just means that they have your bank details, they know you're a practice, and they have the ability to pay you. Not all medical aids will allow their patient to come see you then. So then we started looking at contracting into them, and that I approached each medical aid that we were registered with, and then also started looking at those contracts and seeing, is this worth our while? Is this something we feel is fair? Some of them are a little bit tricky because they're very low end and they just want you to charge one price and include any procedures you do in that. So you also have to decide for yourself as a practice, like, can you sustain that? So for us, we've decided to do quite a wide range because one, we would like to see more patients, and two, we feel like seeing the high-end plans allows you to help those that are on the low-end plans and kind of come to a comfortable medium.
And then with that, the being contracted, do you have to pay a fee to be contracted?
No, so no fees.
They just kind of agree to it.
They basically send you a contract, and that will stipulate how they expect you to see their patients and billing and things like that. But also some of them have scores, like where they look at, for example, with your chronic care patients, how many of them are controlled when they have diabetes and things like that. So they do have some expectation of the level of care that you would provide as well, that you'd provide a good level of care. So it's you agreeing to those terms and conditions, and then you literally just sign up, and then they do then stipulate a billing fee that they would pay.
All right. And then obviously then you contracted to them, you mentioned procedures. In terms of doing procedures, what kind of minimal equipment do you need in a GP practice? Is it something kind of you can decide what level of procedures you want to go to, or is there something that stipulates what you have to have?
So most of the medical aids didn't have anything like this, but Discovery actually has a list of minimum equipment that you should have. So that was quite helpful. I mean, we had pretty much everything on the list anyway, which was useful. I think, it just depends. Some GPs don't want to do things like sutures or put on casts and things like that. We have equipment for everything because we weren't sure what we'd see. And I do find in general practice, unless it's maybe a bigger thing like an intercare or something, there doesn't tend to be a huge number of procedures. But it is nice if a kid has a cut at home and they can come to their doctor that they know, and it's not a scary emergency room, and you can ease the discomfort a little bit and make them more calm and comfortable. So we decided we would do procedures. And
so do you almost have an element of kind of a walk-in system, or is it all kind of appointment based? Because if you're kind of like cuts or trauma or something, you can just walk in, or...
So we wouldn't turn somebody away if they walked in, but it's not our preferred method. So we do try schedule people. So even if somebody phoned Daisy Ann and said, hey, I've got a bit of an emergency, she can tell them, okay, you can come now, but there is a patient waiting. Or, if it's not too urgent, if you come at 2 o'clock, for example, instead of right now, we can see you immediately, and then you're not left waiting. So I do prefer knowing that we would never turn somebody away. All
right. Okay, so you've got all your basically registered with the medical aids, you've got your setup done. Was that kind of then good to go, or did you have a few more challenges along the way?
So just the setup did take longer than expected. So the room that we rented, or the unit that we rented, was essentially just a rectangle that was empty. So we had to decide, how do we want to use the space? Do we just want to put in 2 rooms? We realized quite quickly that we had enough space to put in 2 more rooms for other practitioners. And we could build a little procedure room, and just deciding on how we wanted then the place to look and feel. We tried to move away from a super clinical aesthetic and just tried to keep it feeling more comfortable and homely. Dealing with contractors always takes longer than you expect. So that pushed our date that we expected to open back by pretty much a month.
Okay.
So that was unexpected. And then even small things, but we decided on desks that we wanted and ordered them ahead of time. We're told that they would be ready when we were due to open the initial date, and they still weren't ready when we needed to open
a month later.
So I think that startup is a lot more complicated, and things don't go according to plan. So you can't be too set in stone. You need to have a buffer of not needing a salary initially, even, because you're going to have a lot more costs than income for those first, even now still.
And then in terms of insurances, obviously we do have kind of our basic MPS, but is there any extra insurance that you need? And obviously now from SHIPS in terms of practicing defensive medicine, so if there's a procedure that perhaps goes a little bit wrong or something, how are you covered? And what steps do you take kind of for the legal practices of it?
So we actually spoke to some insurance people about this because we weren't quite sure. Did we need something kind of overarching as a practice insurance versus our individual insurance? So even though it's an Inc., you're ultimately responsible as individuals, and even if somebody, for example, sued the company, you would be responsible as the practitioners. So very important to have your good practice insurance, or medical malpractice insurance. So Carl and I each have our own separate ones. And then we do have a general practice insurance, which is building insurance, equipment insurance. It covers all of that. Should anything go wrong with ECG, for example, it's covered, or theft or something untoward that happens to it. But then there's also I'm blanking on the name, but a public liability insurance. So should somebody come in, stand in reception and slip and fall, it's not, they're not suing you because you practiced poorly. So it covers that. And that covers just the whole building. And then the practitioners that rent from us have to have their own
practice.
Practice insurance.
And then in terms of kind of the flow of the practice, they come in. Did you decide that beforehand? What patient registration forms you were going to do, or how your reception was going to work? Was that something you and kind of Carl just got advice on, or how you felt it should go?
So this was one from seeing how you did on SHIPS, how you see it done at other practices. We decided that we'd like to be as paperless as possible. And so what we do is send people a link where they fill in a form. So we capture all their details, contact details, medical aid details, and input that on our system prior to them arriving. That then also allows us to...
And how did you come about that system?
Just decided on it. So
the form and the online form and stuff you created yourself?
Yes. So other practices I've been at have been more paper-based. Somebody comes in and they still fill in the form, and then it's just time wasted.
And
because
paper wasted.
It could be done. You only look at that paper for those 5 minutes that you're transferring the details. So if it wasn't that, it would be at least, have a tablet and let them fill it in there. But this has worked quite well for us. And then it also integrates with our digital record system. So that has the booking system built into it, and that sends off a pre-check to the medical aid, for example.
Nice.
So when the person arrives, we already know, are they going to be covered? Are they going to be partially covered? Or they're not going to be covered at all? And why?
So that's a very cool system. Where did you come about that system?
So that we came across at the conference. So we use one. There are a few of them. And I think there's pros and cons to all of them. So you have to just, I think, meet with them, have a demo of their thing, and see what suits your need the best.
And are all of the options all linked to the medical aids, or?
I think many of them are. So
That's quite helpful.
For us, one of the main things was we wanted to stay debt-free and not have to do collections and things like that. So knowing upfront that like, okay, there's a co-payment for this patient, or they'll cover this but not that, it just helps us get the payment done immediately as the patient before they leave. And it's very rare that we have any outstanding amounts.
Okay, that's good system. Yeah,
it's just because from what I've heard from speaking to other people that have, and also the conference, but practices often fail because of debt, and trying to keep tabs on that and having debt collection agencies, it just gets messy and tiresome. And it's just, for us at least, because it's not big ticket items like an orthopod would have, people can pay up front. So we've tried to do that.
Okay, and then kind of you've started now, you've got going. That was since the beginning of this month?
No, we've been open since the end of March.
So a few months now. And since you've started, have there been any adjustments to kind of your plan, and how's the running going since you've started?
We kind of had an expected trajectory of how busy we'd be by now, which we're a little bit further behind on than we planned. You live and you learn. Like, for example, we thought potentially we'd be ready to have 2 doctors at this stage, but we're not busy enough. It doesn't make sense. So Carl will be going back for another contract, just to ease the sort of financial burden of having to cover 2 salaries here. There are small things like, we started with a receptionist from day one, and we did think that that was an important thing, to have somebody that was warm and welcoming, because that's your first point of contact. And when people are feeling awful, like, they need a little bit of extra like TLC. And Lizzie Ann, the receptionist we have, has been like an amazing fit for that. Where, those first few months I did wonder to myself, like, could I have just taken the bookings myself? And I think depending on what your financial status is at the time you start, you could definitely manage your bookings yourself. But we also met her and felt she was such a good fit, we didn't want to potentially lose that asset. But in hindsight, I do think could have done a little bit more and tried to cut back on costs a little bit. But I think in the long term, it's still a good decision on that one. But for somebody else starting, if you're going to have 1 or 2 patients a day, you have enough time to answer the phone. So big learning curve, gosh. From what we've done before to now. I mean, just deciding on a phone system, for example. Like, do you need a landline anymore? We decided against it because we said a cell phone can be answered from anywhere. And people WhatsApp us. Honestly, that's the most common way that they book. I did think the online booking systems would be a lot more popular, but they're actually not. They just still want to speak to a person and book that way. 1 or 2 of the younger patients, or sometimes the busier patients, tend to use the online system. But that was another interesting curve, and I think like the very mobile way we do it works.
And then, so obviously a big learning curve. If you had advice for someone wanting to start practice, is there kind of a quicker way to learn all the stuff that you've learned, or is it just trial and error, speaking to people?
I think an important thing is to speak to people, and it sometimes doesn't help to speak to the GP practice that's established for 20 years, because they did things really differently to us, and times have moved and systems have changed, and it's useful to learn from them for sure, but like, talk to people that have done it more recently, for sure. I would say like sit down and put pen to paper, or at least type it out and have like a business plan, because just things like budgeting, you underestimate what this will cost you, and also how long you need, like what do you need in terms of a buffer before you can turn this into like a successful practice that is making money, that you can pull a salary from. So I think what happens is people go into it thinking, like it's a sure done deal. It takes time and you need patience. So sometimes, people do locums and things like that to support their income. For us, we sort of decided that like, if we're going to do it, at least one of us needs to be here and just like push
it.
Because you don't want to miss the patient that phones in an emergency or something like that. So I think.
And in terms of getting that information, like how to budget, taxes, things like that, is it just kind of online resources, or is that when you were speaking to your accountant, was those the kind of questions you were asking?
Yeah, I think because again, like I have a friend who opened up a practice as a specialist who, from what I understand, isn't set up well in terms of taxes and accounting.
Okay.
And so you also have to deal with somebody, I think, that knows the medical field, and same with marketing teams. Like they have to know what's legal and what's appropriate for advertising within the medical sphere, because it is a little bit stricter. So you need people to support you who know the type of business you're in.
Okay.
So I think that would be a big piece of advice. I think there is a wealth of information online. Sometimes it's not specific to the South African demographic, which can be a little bit tricky.
Okay, all right. And then you're saying kind of find people that have knowledge of the medical sphere as well. Are there lots of people like that, kind of marketing accountants that know about medical practices?
Yeah, so I think there's quite a few, at least there's a number of accounting firms. Like they don't have to be medical only, but they have to have practices on their books already.
Okay.
If they're primarily dealing with different groups and have never done medicine, like, they can't assist you to their best ability, I find. I think when it comes to any team that you're going to sign up with, like, make sure they can walk the walk, because, for example, marketing teams know how to sell your product. And in our experience, we've had somebody that like kind of really overpromised and underdelivered.
Okay.
And we didn't know better, and like we were so optimistic that like we were just like we're giving them more time. And, it's like you have to know what you need, and sometimes that's hard to figure out straight at the start. But also, if you feel like you're not being attended to in the way you feel you need, or supported or understood, like ask for more or move. Like don't accept that substandard experience, because you're trying to build your business and like that's your priority. So like not that you have to be rude about it, but don't worry about leaving a company if they're not serving your purposes. So I think that was a big learning curve for us. Like we're both too nice.
Yeah, very trusting. Yeah. Which is tough, I suppose. We don't have that business mindset coming in from medical school.
And we don't know what like little things to look out for or what to expect.
Okay.
Yeah. I think it would be to know what your intention is, like what the type of practice you want to be is, and that can vary quite a lot. There's no right or wrong. And then to really like sit and put that down on paper, and then build the team that you need to support you, because we don't know enough. So in order to do things right and not be caught out later, you don't want to end up with like a big bill from SARS because you didn't know better. Just get the support you need, and the team, like your business will grow in the right way then. More organically.
Well, thank you very much for talking to me, and I wish you all the luck with your GP practice.
Thank you.
I do live in the area, so I'll refer whatever patient I know here. But good luck and well done in all the things that you've learned. It's big growth from when I saw you last on the ship, so you've learned a lot. So very good, well done.
Thank you so much.
Thank you.